All right, this is normal peripheral smear. How do we know this is normal peripheral smear? Well, we have a neutrophil here with 3 segments, and we have RBCs, and those RBCs عندهم central pallor. There is central pallor here. This central pallor is very important because if you have increase in the central pallor, it suggests iron deficiency anemia. And if you have decrease in the central pallor, like this RBC, مثلا, or this one, those 3 RBCs here, it means what? It means this is spherocytosis. Okay? So normally you should have RBC like this one with mild central pallor. Okay? Now, severe iron deficiency anemia. Look at the central pallor here. It's increased, right? Central pallor here is more. Number 2, you have different shapes of RBCs, different size and different shape. We call it poikilocytosis or anisopoikilocytosis. Aniso means different in size. Remember, aniso فيها S, but different in size. Poikilocytosis, different in shape. Now, microcytic means what? You have the size of the RBCs are small, okay? Like this one. Now, hypochromic means you have central pallor. Hypochromic means the pigmentation, the central pallor is decreased, okay? That's why we call it microcytic hypochromic anemia. Iron deficiency anemia. Why do we call it microcytic hypochromic anemia? Because the RBC's size is less than the lymphocyte nucleus size, and hypochromic because of the central pallor. Now, macrocytosis. Macrocytosis means macroovalocyte, like this one, large RBCs, larger than the lymphocyte nucleus. That's how do we compare. Look at this one, and compare it to the lymphocyte nucleus. You will see إنه الRBC هنا أصغر، عشان كده نسميها microcytic. Okay, now Howell Jolly bodies, it suggests that you have acyblenia, non-functional sibling, or hyposiblenism. These are the Howell Jolly bodies. Okay. Now, in myelofibrosis, you get teardrop cell, or يسموها كمان dacrocyte, which is a cell that mimics a teardrop, دمعة العين يعني. طيب, this is the dacrocyte or teardrop cell. This is very suggestive of myelofibrosis. In your exams, when you see teardrop cell, it's myelofibrosis. Now, also in myelofibrosis, you get nucleated RBCs. Now, target cells, these are target cells لأنه مثل علامة التارجت، مثل علامة الهدف. شايفين هنا؟ كأنها علامة الهدف target. We call it target cells. There is differential for the target cells. في mnemonic حلو هنا called halt the target. H for hemoglobin C disease, A for acyblenia, L for liver disease, T for thalassemia. Those conditions, in those conditions we see target cells. Okay. Mechanical valve. In mechanical valve زي ما قلنا حتشوف fragmented RBCs اللي هو schistocyte. Those are the fragmented RBCs. This is fragmented RBC. This is fragmented RBC. This is fragmented RBC. Okay. This is also fragmented RBC. Now, in uremia, زي end-stage renal disease على hemodialysis, what do you get? You get echinocyte or bar cells. This is the echinocyte or bar cells. طبعا مهم إنه نفرق بين spar cells and البار cells. البار cells اللي هي الإكينوسايت زي هذه تكون مثل الدائرة وعليها نتوءات زي كذا متساوية ومتقاربة في الحجم والسايز. إنما الأكانثوسايت which is spar cell زي this one تكون فيها نتوءات بس هذه those projections are not very similar in size and direction and shape. Like هنا تكون symmetrical and uniform. هنا asymmetrical and not uniform. Irregular shaped projections. Okay, we see acanthocyte in severe liver disease like cirrhosis, in A-beta lipoproteinemia, post-splenectomy, and in hypothyroidism. However, when you see echinocyte or bar cells, it means uremia. Acanthocyte means liver disease, post-splenectomy, or hypothyroidism. Now, البايت cells. بايت cells اللي هو الديجماسايت. البايت cells هذه بنشوفها in G6PD deficiency. This is the bite cells. هذه الهينز bodies, and those Heinz bodies, when they are bitten by the macrophages in the spleen, بيحصل هذا الشكل عندنا on the right. So normally you have in GSXPD, you have Heinz body. Those RBCs, when they pass through the spleen, the macrophages in the spleen will eat those Heinz body, and you will get the bite cells or digmacyte. So digmacyte is bite cells, dacrocyte is teardrop cells. Okay? And uremia, you get echinocyte اللي هي bar cells, and spar cells اللي هي acanthocyte here. Okay. Now elliptocyte، الاليبتوسايت هذه اللي تكون زي كذا مثل الاسطوانه الطويله هذه زي كذا مثل الديدان، هذه بنسميها elliptocytosis. اوكي، elliptocytosis بنشوفها في مرض اسمه elliptocytosis. Now in sickle cell disease what you get sickled cells مثل علامه الهلال. طيب هنا هذه sickled cells. Now schistocyte or helmet cells، هذه الهلمت cells لأنها بتشبه الهلمت. This one هذه عبارة عن fragmented RBCs بنشوفها in microangiopathic hemolytic anemia and in macroangiopathic hemolytic anemia زي DIC, TTP, HUS. Those are microangiopathic hemolytic anemia. والماكرو قلنا aortic stenosis والميكانيكال valve. Now spherocytes هذه الصورة بنشوفها in two conditions. Number one, hereditary spherocytosis. Number two, warm autoimmune hemolytic anemia. Okay? Now how do you know spherocytosis? الRBCs تكون very round، هذا رقم واحد. Number two, there is no central pallor. فاكرين central pallor اللي حكيت لكم عنه in the beginning؟ هنا there is no central pallor، نسميها hyperchromic. عشان كذا في السفيروسايتس what do you get؟ MCHC حيكون high. MCHC mean corpuscular hemoglobin concentration will be high. MCHC in spherocytosis. وهذا very common في exams. So they ask you إنه they give you a scenario in patient with anemia and family history. Well, MCHC is high. What's the diagnosis? It's spherocytosis, because if you have increase in the central pallor, decrease in the central pallor معناته there is absence of the central pallor. No central pallor معناته this is hyperchromia، معناته ال MCHC is high. هو الجولي بوديز هذه حكينا عنها. reticulocyte using methylene blue stain. reticulocyte فيها RNA remnant، هذه ال RNA remnant using الميثايلين blue stain. هذه usually ما تجي بالامتحانات. Now regarding the iron profile, we will talk about it in a separate lecture because it needs concentration and it deserves a special attention.